everyone, welcome to SQ TV Global. I am your host Rajni Bharara, and today again on the show I have with me a very special guest. His name is Dr. Nusrath Dr. Syed Nusrath, and he is a cancer surgeon. Today again we have Dr. Syed Nusrath on our show, and today on the show we are again going to speak with him on a very, very important topic. And the topic of today's discussion is tongue cancer. Well, we are going to talk more into details about tongue cancer. But before, we would like to welcome him to SQ TV Global and also to this amazing, informative and educational show. Hello, Dr. Syed. Welcome to SQ TV Global once again.
Hi, good evening, Rajni Bharara and SQ TV. Thanks for inviting me for this talk on cancer of the tongue.
Thank you so much, doctor. And, it's a pleasure always having you on the show. And you actually enlighten our audiences and also us on such an important topics. And today, like I mentioned, we are again going to speak on a very important topic, which is tongue cancer. So, doctor, before I ask you anything, into details about tongue cancer, I would like to start from very basic. So what exactly is tongue cancer? If you can please explain that.
Tongue cancer is a cancer where the patient will have an ulcer over the tongue. Most commonly, it will be in the lateral aspect of the tongue. That is the right side or the left side of the tongue, sometime with the tip of the tongue, or sometime the whole of the tongue.
Okay.
Now, this is like another cancer, but it is very, very deadly disease because the person cannot eat if he has got tongue cancer. He cannot chew the food if he has tongue cancer because it becomes painful. The most important thing is whenever the patient has got tongue cancer, he automatically deteriorates and he goes into a state of death because he cannot eat. Only thing what he can do is he can drink some liquid, he can drink some water or some juices or some milk, something like that. Because the moment he tries to chew, as the tongue keeps on moving, the patient will have severe pain. So that is one of the most common deadly disease among cancers.
So, Dr. Syed, also, a very important question related to tongue cancer is tongue cancer and oral cavity cancer the same thing, or they both are different?
Oral cavity cancer means it includes all the tongue. For instance, tongue, then gingivobuccal sulcus, then palate, then tonsils. So oral means that it's over whole of the mouth, but tongue is limited to the tongue organ itself. So different. It's oral cancer. It's one of the type of oral cancer.
So let's keep oral cavity cancer topic for some other day. We would like to, focus on tongue cancer today. So Dr. Syed, so basically I also would like to know from you that how does tongue cancer develop and how does it happen to a person?
Normally, you can see, Rajni, what's happening is people are taking this gutka. This is the most important cause, betel nut, where they take slaked lime, which they take. This is carcinogenic. So that causes irritation over the teeth, in the tongue, and that causes cancer. So this is the most important thing. You, through the media, you're supposed to tell the patients or the viewers not to chew tobacco. Tobacco is the main root cause of tongue cancer. The moment they take that, they start developing the tongue cancer, which is really injurious. Next thing is the sharp edge of the tooth, You have some tooth which keeps on going and cutting your tongue, that causes irritation. And then that is one of the second most important cause for the tongue cancer. Third one is the spicy food people will be taking, Spicy food, that also is one of the major causes of the tongue cancer.
Okay.
And the other cause is people are consuming alcohol. So that is also spirit, what we call. So that is one of the most important cause for this tongue cancer. And previously we had a disease called syphilis. So that's a venereal disease, which is the most common cause for tongue cancer. But nowadays what is happening, the most important cause is the betel nut and the smoking. Smoking plays a very, very major role in tongue cancer because they start smoking and that causes irritation. And that is the most common for cancer of the tongue as well as cancer of the lung.
So, doctor, you actually mentioned that spices, eating too much of spicy food or too many spices can be a major reason for developing tongue cancer. So, as we know, that India is famous for eating spices and having too much spice in their food. So, should we say that India is having the most number of patients with tongue cancer?
Yeah, I would say yes. The reason being, spicy food, what is, they take this mirchi, they take this chili, and they don't consume enough of other protein. So whatever goes inside causing irritation, the most important etiological factor for the cancer is irritation. The
Yeah.
spicy food, it goes there and causes irritation. So that is the most important factor which causes irritation, and then the tongue cancer. Second being the betel nut. Some people, what, they keep it in the oral cavity, they keep it and then store it. And then slowly it keeps on releasing. So that causes irritation, and that causes the most important cancer. Yes, what you asked is spicy diet. Once a patient stops, there is a study where they have stopped taking this spicy diet, and then there is prevalence of tongue cancer is very, very less compared to people who are taking. So the spicy diet causes two cancer. One is the gastric cancer, and second one is the tongue cancer.
So, does genes have or genetic have any role to play in it? I mean, because mostly cancer is something that goes into that is in the genes of their parents. I mean, if the parents or the grandparents or the ancestors are having, so does carries on into the other generations as well. So, does that happen with tongue cancer as well?
Yeah, Rajni, what happens is now there is lots and lots of research going on. We, in fact, are doing in our medical college as well as outside this research. We have a cancer hospital. Yes, they're looking, but it's not an evidence-based conclusive now. Yes, they say, because this is more common the breast cancer as well as the cervical cancer. But the most important predominating factor is the betel nut, tobacco, which is the most important cause for cancer. But yes, they are doing a study where they're taking the genes from their father or the grandfather or the grandmother. But now the things are very much changing in oncology and cancer.
Okay.
Previously, what you used to think it's not there. The disease which were there previously are not seen nowadays. So yes, I hope, let me keep my finger crossed and say that definitely it is going to be one of the most important cause. At least we can prevent some cancer, telling the children not to take, because especially North India, I see they take a lot of gutkhas, especially these places like Rajasthan and all that. They have lots and lots. And down south also, when we were small kids, there was a cancer hospital in Tamil Nadu. So there also oral cancer and tongue cancer was most common.
Yeah, especially in UP and Rajasthan, all these places, people do have a habit of, munching into good cars and all these things. So, doctor, I also would like to know from you, does age has any role into it? Or would you say that any age person or any age man or woman can get tongue cancer, or only older people who chew good cars or who are into alcohol and who eat spicy food can only get it?
See, Rajni, what happens now is now the small kids also have started smoking, number one. And I have seen a lot of young, it has become a style. They have a cup of tea, they just stand and chit chat, and then they have a pan parak, gutka in their hand, they chew
Yeah.
it.
Mm-hmm.
And definitely, yes, so now the age is not bar. Apart from the 10 years, not less than 10 years, of course, they don't take. I see people smoking, so that plays a very more important role. But yes, elderly people, because the duration of the gutka chewing and the gutka taking and the cancer is equally proportional. So what happens is they keep on chewing it and then develop. And we say that they have submucous fibrosis, small lesions like that, where they cannot open the mouth. That's how they come to the doctor, or they cannot chew. So that is the most important factor. So age related, yes, elderly they are, but we are seeing some cases of younger patient also back in our baby cancer hospital.
And doctor, what are the signs and symptoms of tongue cancer, and especially the early signs and symptoms, so that we can know beforehand that we are developing tongue cancer?
Yes, exactly. First and foremost is see that your teeth are good. You don't bite your teeth. That is the most important cause, because chronic irritation of your teeth to the tongue is the most important cause. So patient will come with history of an ulcer which does not heal. That is the definition of a cancer. An ulcer which does not heal, and the ulcer which bleeds. So once your tongue keeps on touching that teeth, it bleeds. So there are some ulcers which are known as aphthous ulcer, which is due to vitamin deficiency. So you should differentiate this ulcer from that of a tongue cancer, because that is very painful. And that is once you have an exam or stress or giving an interview with a Scoop TV, you'll have stress. So that time, stress, I'm just joking, but stress is the most important cause for the tongue cancer. So in that case, what you are supposed to do is you have to be very, very careful. That is one of the most important. Second thing is increase the salivation. The patient keeps a handkerchief in the hand and keeps on spitting, because that causes irritation, and the salivation increases. And then difficulty in speech, this becomes later on. But the first symptom, as you put in, will be very difficult ulcer which does not heal, and there is a bleeding and a small ulcer in the mouth, and difficulty in swallowing, difficulty in drinking later on, and then difficulty in articulation of the speech is the most important cause for the cancer. Then added to that, the predominant features where they keep on taking this gutka and all that, or smoking, is the most important cause for the tongue cancer. So this cancer, when started, it is painless start.
And how do we diagnose it at home?
So any ulcer, unless and prove otherwise, take it from me, it is a cancer. And any ulcer or any swelling, unless and prove the tongue, is definitely cancer associated with this other predominant factor. So once the patient has got an ulcer, he has to report to the hospital, whether it's a small ulcer or a big ulcer, and especially on the lateral side, that is the right side or the left side of the tongue or tip of the tongue, and disarticulation of the speech, is not able to speak. And then there is some excessive salivation. And then later on, the patient will have a bad odor in the mouth. Whenever you sit next to the patient, you smell that there is some odor. So these are all the pre-cancerous conditions or predominant features where the patient will present. And then once it keeps on going later in stages, then you have severe pain, you're not able to eat, and then the process starts. And finally, you have small nodes, which we call small swelling in the other side, where it has already advanced to a very, very later stage where it cannot be curable.
Would you say that in the earlier age, if we diagnose it earlier and at a correct age and a correct time, so tongue cancer can be cured?
Exactly, Rajni. That's a nice number. See, what happens is cancer nowadays, through your great media, you have to convey the people that earlier stage better. Early cancer, we call everywhere, early tongue cancer, early breast cancer. So earlier stages, what happens is you have a good prognosis. Why? Because that is the starting of the stage. Whenever patient has these symptoms, whatever I've told you, they report to the doctor. So what they do, we have got nice facilities now. So we take a biopsy from that area. So once you take the biopsy, we call it a T1 stage or T1S stage, in situ stage, where we just do screening of some patient. There are a lot of cancer hospitals where they're doing a lot of screening for these patients. So once you do the screening, mostly they go to dental doctors, and sometimes they miss. They just see the tooth and then they send them out. So in this case, once you do a screening, number one. Second thing, once you do a biopsy, that is known as the T1 stage, which is the earlier stage where you can catch the tumor and then you can plan for the surgery. So in that case, what happens is you chop off part of the tongue. Now, once it goes to T2 or T3 or T4 stage with added lymph node, there the patients will have problem. There the cure is bad.
And doctor, now let's talk about the very important thing about this tongue cancer, which is treatment. So, what kind of treatment is involved in tongue cancer?
What happened, Rajni, in this tongue cancer? What is happening nowadays is the most important factor in the tongue cancer is the biopsy you're supposed to take. We have to take a punch biopsy from the tongue and then find out whether this is a cancer or it is a non-cancerous condition. Non-cancerous, you're better off. So once you take that biopsy, and then it comes out as a cancer. So once you come that as a cancer, you have to definitely treat. You have to screen the whole of the head and the neck and find out that it is limited only to the tongue or it has spread. Because these cancer, even half a centimeter, 1 centimeters, are dangerous than the other breast cancer or thyroid cancer or wherever. Why? Because the space is less and it grows inside. It goes into the tongue, and tongue is a very vascular structure. This is where the metastasis, it multiplies. So once you have this, you take a biopsy and you just diagnose that this is the tongue cancer. The treatment should be started. Now the treatment is in the form of surgery, radiotherapy, and chemotherapy. This is standard for all. Now, surgery for the early tongue cancer, is just remove a tissue wide over there. If it is just involving less than 1 cm. So the prognosis is very good because it has not further spread. And you have all these new modalities, radiology. We take a CT scan and find out whether there are any lymph nodes involvement, because we cannot see this. It's an oral cavity.
Okay.
Once you do that, we excise that.
So, doctor, also, now that you have also talked about the treatment involved in tongue cancer, I would also like to know from you: are there a few things, or is there something that people don't normally know about tongue cancer? Because mostly people do have a knowledge about breast cancer and other types of cancer, but when we talk about tongue cancer, not many people know about it, because like you mentioned, that it is something that you develop on your own. I mean, if you consume too much of alcohol, or you eat too much of spice, or if you chew and these gutkhas and all these things, then only you develop this cancer. So not many people know about it. So are there something, or is there any important thing that people not normally know about tongue cancer that you would like to talk about today?
Yeah, I agree with you, Rajni. What happens is media, persons like you should keep on telling patients or people who are watching the TV and this media is, number one, the moment you are taking gutkhah, you better be careful of your oral cavity, because I have talked with lots of people who are consuming, which when you they say nothing is going to happen. Marna to marna hai, that attitude. Because gutkhah has become an addiction.
True.
It has become an addiction. I got a patient which you will not believe, that they are saying that I cannot pass motion in the morning if I don't take this gutkhah. The moment he gets up in the morning, the first thing is he does not do anything. He searches for his gutkhah box and then taps it, put it in the hand, put it in the oral cavity, and then he goes to the toilet or newspaper and then sit there for half an hour. Psychological. This is not the fact. There is nothing in relation to your tongue and for your bowel motion. That comes automatic. But psychologically, he goes sit over there and then he passes. So what I wanted to tell you through the media is, do not have these habits. Once you have these habits,
Okay.
do not cultivate this habit.
And also, is there any myth related to tongue cancer?
Yes, Rajni. Everyone says, this is probably a papam, what we have done in the Purna Janam and all that. And no scientific person, will believe this. Okay, then I'll tell you one patient where I saw a tongue cancer, and then worms were coming out of the mouth. Can you believe it? That was an advanced stage. Then they say that this is a myth. This is something we have done in Purna Janam, and that is how the work. No, it's unclean. The flies comes and sits accidentally, and then the worms comes out. That happens everywhere. The breast cancer or thyroid cancer or any cancer. You keep it unclean, it comes out. then the patient will have bleeding. So you have to be very careful because it erodes a major vessel. And there the bleeding starts and the patient will bleed to death. So that is a very, very important factor. Earlier stage, it is better because you identify the disease, you cure the disease. Later the stage will have problems because you have to cut whole of the tongue or half of the tongue for that matter. So it's always better that you just have a earlier stage and do a screening.
All right. Thank you so much, Dr. Syed, for again coming to SQ TV Global and speaking with us. It was again such a pleasure having you on the show, and it was such an educational and informative show, like you always do. So thank you again for your time and doing the show.
Thank you very much, Rajni. Anytime I'm there for. Thank you very much. Take care. Stay safe. Bye.
All right, guys. That's it from SQ TV Global. Keep watching and do not forget to subscribe to the channel.